Good evening, everyone. I'm just going to do a quick video on Veterans Affairs. It's an area that's been come significantly over the past year or so, uh, especially in regards to how vets been necessary to receive medical care and just the programs that have been made available to veterans. And veterans means people as part of the Canadian Forces, but it also involves people as part of the RCMP as well as other public safety employees at the federal government level that it would be fall under Veterans Affairs. The reason why I'm bringing this up is I believe it's a good example where we should be kind of having some discussions around this and getting rid of some of the kind of the misinformation being provided by the media, as well as some radical veteran groups that basically profess that they're acting on behalf of veterans when in fact they're only talking for a few veterans. In some cases they're not really even talking about the complete picture. So let me talk about a few things in play here. Now, back before Stephen Harper took government, the Liberals government of Canada had proposed a new Veterans Charter. Now, this Veterans Charter was supposed to be kind of relook at everything a part of Veterans Affairs, because we were coming through a stage where we had a lot of veterans coming back from Afghanistan tour duties, and as well as some other initiatives on peacekeeping back in the mid-90s to 2006. So this Veteran Charter was the kind to address different aspects of the needs and wants of basically veterans. So it deals with everything from mental health services to rehab to healthcare to career transitioning to just for support of families. Now, most people that call out Veterans Affairs, they don't actually have gone in and look at the Veteran Affairs charters in terms of what it plans to deliver. They basically are purely looking at a few people that where the system may have failed them, so they're basically kind of pushing at that. So what I want to highlight here is that when Stephen Harper took office, he basically bumped up the Veteran Affairs budget to where it's about almost close to $3.5 billion a year. Of that, basically, all that money goes into and managed out of Charlottetown, and it handles different programs for veterans. And that's basically what you're going to probably not hear about in terms of the discussion about it. What you're going to hear is the $1.2 billion unspent money. Now, every year, if money is not spent by the government, by department or agency, it's returned to the Treasury, and that's called what's called lapsing funds. So before you just pin out and say that money is entitled to the veterans, each year we lose more and more veterans, so there may not be the need for medical attention, or maybe some of that services wasn't spent or covered during the year in terms of what was required in terms of the vet's needs. So in general, Veterans Affairs has done a good job to handle the vets. Could they do a better job? Yes. But when you hear lapsing funds, I think you need to be very careful and take a little bit more understanding of why it's done. People like to spend money when it's unspent, that basically the government's pushing for that. But in essence, a program runs, if money isn't spent, then it has to be returned. It's part of fiscal management controls. Let's talk about things here initially, right? Now, I went back and did some analysis back into the 90s, into 2006. It's very difficult to get a clear picture of what was spent in the 90s because the information is very fragmented. But I can tell you this, that there's a consistency due to austerity measures of the Liberal government. They basically cut back spending on all program spending at least 5 to 10%. So it wouldn't be surprised that they basically cut Veterans Affairs budget back then as well. I was only able to look at a couple examples where I did see some cuts, but that was again sporadic because the information of pulling it from the internet was very difficult. What I did see from 2007 and 8, I did see Stephen Harper looked at a budget of $3.2 billion for Veterans Affairs, which he was increasing at least by 2% or the cost of inflation, right? I also did see that in most cases veterans were being treated fairly with the system. Now, there are some concerns around policy, especially with pensions and some of the other options where lump sum payments were handed out, where the veterans would rather see annual annuities or monthly new annuities that come out, that they would like to see some of that happen, or just a little bit more better treatment for post-traumatic syndrome, which is an area that has come more and more into the headlines because we're seeing it's not just with military personnel, but it's also with police officers. It's an area that was never really probably handled properly over time. It's finally been identified over the last 3 to 4 years, and Stephen Harper has made a commitment to make sure there's more mental health people to help assist people with these type of syndromes or other mental health illness. So one of the commitments from the federal government is more and more frontline workers. Now, what you may hear, and it's a misnomer, that Stephen Harper closed offices. What he did close is he closed backroom offices that were not adding any value to the overall care of veterans. Veterans were still able to get care within those communities through other offices. There was support there. So it's a misnomer to say veterans were not being treated fairly in general, because that's just wrong. That was not clearly what happened. Second point is because the Veterans Affairs wasn't running properly in terms of the bureaucracy, Stephen Harper had no choice, but he replaced Julie Infantino with Aaron O'Toole. Well, Aaron O'Toole is a former military guy, and he's been starting to clean up it. He changed some of the procedures in terms of making things. For example, one of the pitfalls that people were complaining about is if you lost a limb, you had to file paper each year to say that the limb hadn't grown back. So he changed that up. I suspect over time policies like that will be reviewed so it's not required in terms of the justification and all that, in terms of for the medical benefits. But it takes time to fix a bureaucracy. So not all this is related to Harper. This is related to some of the bureaucracy in the government of Veterans Affairs Department in terms of executing programs. That's the reason why I wanted to bring it up. The other thing too is, as I said, is if you look at comments, you're going to see a bunch of radical groups speak out about it, especially lawsuits. Well, some of that, anything happens with lawsuits can happen, right? People are upset that they're not getting their justification, so they may file lawsuits, and the government has a right to defend itself in court. Is it sad that we take on the vets from? Yes, but in essence, we should really understand the scope of why those lawsuits happen and what can be done to prevent them going forward. But that's not what you're going to hear from the NDP or Liberal government. You're going to hear the constant contact that Harper's failed veterans. And that is not necessarily the case. So the reason why I did a quick presentation, because I want to clear up some of the stuff. In this presentation, the information came from polling resources, and also talking to friends of mine that are former vets. And each one of them, from the information out and the people I spoke to, have said Veteran Affairs has done well. So I would encourage you to get beyond the hyperbole and the less than factual information from the NDP to actually dig in. You may want to go to the government's website and look for the RPP reports for Veterans Affairs to get more details.